In this video, we're turning to the topic of the causes of relapses, or as I've labeled it, relapse triggers. One step to gaining control over relapses is to identify those things that cause them. Some relapses may be due to the waxing and waning of your illness, but other setbacks are caused by factors that you can affect. We'll look at 7 common triggers and what to do about them, beginning with what I've labeled here as overactivity. When we ask people in our program what makes their symptoms worse and causes relapses, overactivity is almost always listed first. Overactivity means being more active than your body can tolerate. The result of overdoing is an intensification of symptoms called post-exertional malaise, which is discussed in another video. The key fact about post-exertional malaise is that the increase in symptoms is out of proportion to the overdoing. Let me give you some examples from people in our program. First comes from John, someone who functions about 40 or 45% of normal. That's in comparison to an average of about 25% overall from people in our program. He's able to spend an hour a day gardening without intensifying his symptoms, as well as doing other things, including work and housework. But one day recently, when he spent an hour extra in the garden, that is 2 hours instead of 1, the extra time put him in bed for the rest of the day and triggered a relapse that lasted 10 days. All that for 1 extra hour in the garden. Mary is about at 20% of normal. She says that if she goes 1 hour past her limits, she has to spend 1 day in bed, and if she's over her limit for several days, it means 2 to 3 weeks in bed and the loss of 6 to 7 months gains. That means that it's a half a year or more before she's back to the same level of functioning that she had before that overexertion, way out of proportion. Rose has severe CFS. She's bedbound and functions at 10% of normal. For several years, week-long family visits triggered relapses that each lasted 6 months. Again, a very big price. Pacing is the antidote for overdoing, so let me put that in here. Pacing. Pacing is discussed in more than a dozen other videos, so I'll just refer you to those at this point, and also to our video on Rose's experience using pacing strategies to deal with house guests. That's the title of that video is Relapse Success House Guests. The second relapse trigger is poor sleep. For most people with CFS and FM, sleep is not restorative, and that means that people wake up tired rather than refreshed. Poor sleep can intensify other symptoms such as pain and fatigue, so treating poor sleep is often a good place to begin symptom management because treating sleep can both improve quality of life and reduce other symptoms. Treating sleep usually involves some combination of changing sleep habits and sleep environment, using medications, and treating sleep disorders such as sleep apnea. So let me put those down as the treatments or responses for poor sleep. That is, addressing sleep habits and environment, using medications, and treating sleep disorders. For more, see the video on treating sleep and the articles on our websites. The 2 websites are, first of all, down here, cfitselfhelp.org. That's our self-help program website that has several hundred articles as well as information about our classes. And the other website is Treating Chronic Fatigue Syndrome and Fibromyalgia, treatcfsfm.org. And that's a site that we did jointly with Dr. Lapp, the director of the Hunter Hopkins Center in Charlotte, a clinic that focuses on treating people with chronic fatigue syndrome and fibromyalgia. The third most common relapse trigger is stress. That's up here, stress. Stress creates double trouble for people with CFS and fibro. First, the 2 conditions bring new sources of stress to add on to those that you had already. These include the discomfort of ongoing symptoms, frustration about limits, and uncertainty about the future, as well as financial problems for many and also family conflict. Second, CFS and FM make people more sensitive to stress, so that the effects of a given level of stress are greater than they would be for a healthy person. You can combat stress through two types of strategies: stress reduction and stress avoidance. So let me put that down in the treatment area here. So reduction and avoidance. Let me check the spelling here. There we go, reduction. The first means learning how to respond differently to stress by such things as incorporating a relaxation procedure into your day and adjusting your expectations for yourself to be more in line with your current abilities. Stress avoidance is preventive. It means taking measures to avoid or limit exposure to stressful situations and sometimes to specific people. Next category of relapse triggers I've labeled travel, special events. Early on in our program, we realized that travel was very demanding and often triggered relapses. Next, we saw that the holidays, which can involve travel and entertaining, had a similar effect. Over time, people suggested other non-routine events that triggered relapses. These included going to a restaurant, having people over for dinner, remodeling or moving, and for some people, any trip outside the house at all. Having a list showed us that non-routine events are a lot more common than we had realized and often the cause of relapses, and we came to call them by the generic term special events. Like stress, special events carry a double whammy. They are more demanding than everyday life, a danger just by itself, and also they come with expectations and pressure, which can be either internal or imposed by others. How do you avoid relapses triggered by special events? By using a combination of strategies explained in detail in the video on special events, and that is extra rest. That's extra rest taken before, during, and after the special event. Detailed planning, which means thinking through the event and deciding your level of involvement. And then thirdly, discussion, which means talking to the other people that will be involved in the event to get their understanding of your limits and their cooperation with your plan. Next, sensory overload. As I mentioned, overdoing, sleeping problems, and stress are the top causes of relapses according to people in our program. Another cause that's also always rated high is sensory overload. There are many causes of overload, including sensory information coming from several sources at the same time. For example, having the TV on when you're trying to have a conversation, noisy environments, fluorescent lighting, socializing in large groups, being touched or the feel of clothes on the skin, weather changes, and strong aromas. As explained in the video titled Sensory Overload in the symptom series of videos, there are three main treatments for sensory overload: taking a time out, avoidance, and setting limits. So let me put those down here. Time out, avoidance, and limit setting. Leaving a situation that causes overload is the first solution. This may involve a brief timeout. For example, when at a noisy social event, a person might go outside for a break. But if taking a short break is not enough, the next step is to use extended rest. Then there are two forms of prevention. The first is avoidance. The most common form of avoidance is the creation of a quiet and orderly home environment. This usually involves keeping the amount of noise in the home to a minimum, for example, by avoiding use of the TV and or radio as constant background noise. And then the other form of prevention is limit setting. Some people set limits on the amount of time they spend at various activities, such as how long they stay on the computer, the length of their phone calls, or the amount of time spent watching television. Other people report putting limits on socializing. For example, they'll get together with others only in small groups or for limited periods of time. A third type of limit is to select the settings very carefully to avoid crowds and noise, for example, by going to restaurants and stores during slow times. Sixth, other illnesses can trigger CFS and fibro relapses. The other illnesses might be something short-term like a cold or flu, or ongoing medical problems. You can reduce CFS and fibro flares by treating other conditions and by acknowledging that they intensify CFS and fibro symptoms. Often CFS and fibro flare just as other conditions are waning, so taking extra rest at the end of a cold or a flu can help you avoid a CFS or fibro relapse. So let me put those down as treat, which means that's an abbreviation for treat the other illness, as a way of also reducing CFS and fibro problems, and extra rest, meaning take extra rest once the other illness, if it's an acute one, seems to be over. So take a few extra days to resume your normal activity level. Then last is stressful relationships. You may find that interactions with specific people, particularly those who are negative or fidgety, are a source of disabling stress. Responses include talking with the person to redefine the relationship, limiting contact, getting professional advice, and ending the relationship. So I'll summarize those as discussion and limiting or ending contact. So there are 7 relapse triggers and some ideas on how to respond to them.